Welcome to Civil Discourse, a podcast where participants are free to share their ideas, empathize with other perspectives, and who intend to advance to a better solution to fix a societal ill. We will focus on topics that are particularly complicated. In a time where information is from sources more opinionated than ever, our mission is to find solutions and goals to accelerate the nation's progress with cultural impunity. I'm your host, Todd Furniss. Welcome, and I appreciate your joining us today on the podcast that we try and put out every week, and we have been successful for the last few months in putting one out every week. This one's a little later in the week, as I had to do some additional research on something I'm very excited about. And I'm going to give a shout out here to my good friend Amanda. I can't tell you who Amanda is yet, because I'm encouraging her to come onto the podcast. And if I expose her too early, she might get nervous. So let me just say that Amanda, my friend, is responsible for helping me come to learn more about something that she's working on. And it's really, really exciting. So just once again, if you like these podcasts, I encourage you to like, share, and subscribe. As I've mentioned before, we're eager to build our base here and have a thorough and thoughtful discussion on a range of topics. And your support is vital and important, and I'm grateful for it. I'm pleased to report that we're over 250,000 views of my podcast, and I'm hoping that that's a trend that continues. Again, I'm grateful for your support and look forward to having more of these conversations in the future. So now back to today's conversation and my friend Amanda. So my friend Amanda and I are talking, and she's telling me about this product she's working on. Can't tell you what it is. I'm hopeful she's going to share with you when she's ready. But in the course of this, she was telling me about some of the research she had done. And before I get to exactly what that is, I want to remind everybody what I'm doing and why I'm doing it. So I have this and I love this term because it's spot on, hubristic goal, which is to take what I've learned and to keep learning, of course, but to take what I've learned and then use it to hopefully improve the quality of American life. And to do that, I'm hopeful that we're going to do research, we're going to quantify social ills, and then we're going to not only invest, but hopefully encourage others to invest in solving the social ills that we've researched and quantified. So the book is obviously the first one on healthcare. We'll look at other social ills as well, and the ills will map to things that the nation is concerned about. So we started with healthcare. We're going to turn our attention quickly to broadband. We'll then talk about education, food, water, air, and sanitation. Broadly, we'll map to the 17 UN Sustainable Development Goals. And the goal here, our internal goal, is to help, again, with taking market principles, and where market principles don't work, free market principles don't work, then developing other approaches to solve problems. So I'm doing that right now with leaders here in Dallas County to help solve the broadband issue, for example. We've created the first ever healthcare inequality index to start identifying the issues associated with healthcare that can be fixed and to quantify those issues, draw attention to them so that we have specific ways to geographically, quantitatively, and qualitatively solve the problems. Obviously, we wrote a book on healthcare, and we're going to continue to work through these issues on a case-by-case basis. In the course of that, I have an opportunity to talk to a lot of people, and I bump into interesting ideas, and sometimes they're just interesting, and they're not really something that's solid enough for further investigation. But in this instance, I think it certainly has been. So the issue that we want to talk about today is an issue called, or the opportunity in the technology called, digital therapeutics. And what we're doing is we're taking these devices, these smartphone devices, and we're now using them to create treatments and protocols and delivery devices for treatment of specific kinds of ailments. Now, I tend to try and stay away from medicine. I tend to try and focus on things like healthcare business models and economics. And the reason I do that is because I'm not a physician, and I want doctors to be doctors, and I want to look to them for their sage counsel and their advice. and I want to support them in their pursuit of treatments that are helpful for solving diseases. There's a new area, though, which is this area of digital therapeutics, where we're seeing this increasing symbiotic relationship between medicine and technology. And when I use the term technology, I'm really talking about things like artificial intelligence, cognitive reasoning platforms, algorithms, software, and databases and the like, all coming together to help treat or solve medical problems. And so that's exciting to me, and I hope it's exciting to you as well. And we're going to talk about that a little bit today. So when I started this, I was talking to my friend Amanda about digital therapeutics, and to that end, I started doing some homework on it. And of course, and it's unsurprising that there's actually within the construct of the FDA, the Food and Drug Administration, there actually is something called a Digital Center of Excellence. And the Digital Center of Excellence states as its goal on the website to empower stakeholders to advance healthcare by fostering responsible and high quality digital health innovation. And it includes the idea of the smartphone as a delivery model. And they also point to another element of their anticipated outcomes. So they go through goals, objectives, and then anticipated outcomes as including the opportunity to strategically advance science and evidence for digital health technologies that meet the needs of stakeholders. Well, stakeholders includes obviously not only the people who are developing the tools, but also the patients who are using those tools for the purposes of improving their health and dealing with chronic and other forms of healthcare issues. May not be chronic, maybe it is chronic, but we'll talk about that also in just a second. The idea here is really interesting to me because it brings together these very, very different disciplines. It's not surprising that a lot of the intellectual capabilities and the intellectual competencies overlap between technology and medicine. But the way that some of these things are coming together is very, very innovative. The website also that I'm drawing your attention to, and I encourage you to go out and take a look at, includes topics such as software as a medical device. Think about that for a second, software as a medical device. They include a list of experts. So these are digital health experts and digital therapy experts where you can reach out to them and they have their own specific areas of excellence where they can speak to and help play a role in developing new protocols, new therapies, and the like. And I don't want to suggest that it's just software. There are also hardware devices too, obviously. We've seen some of the tools that have been made available by smartphones where you can take an EKG using your smartphone. You can monitor your glucose levels, and there are other things you can monitor as well. They list in their fields of focus artificial intelligence, physiologic sensors, wearables, and the medical Internet of Things, they refer to it, digital therapeutics, software engineering, real world evidence, mobile networks and wireless communication, cybersecurity, and digital biomarkers. All of these things are contributing factors to the success of digital therapeutics. And to give you an idea of the way of how early this is and how much momentum it's grabbing, in my view anyway, as of February 22 of 2021, there were 126 organizations listed as quote unquote participating organizations in providing digital therapeutics experts to the conversation. There are also a number of different communities, collaborative communities they've identified, and they're facilitating and supporting. But it should come as no surprise that we are going to need a different approval process, different kinds of regulators and different kinds of engineers and technologists and scientists who are involved in the regulatory process to evaluate the efficacy and to expedite approval for these technologies. And that's going to be something that everybody needs to get used to. The regulators themselves are going to need to get used to a different approach and a different way of doing things, as well as the people involved in the process themselves. And I anticipate that there are going to be some bumps and bruises along the way as we develop these things in real time. We just don't know how it's all going to play out. And because this is such a new field, we're going to have some growing pains. It happens every time new technologies are developed, and so this won't be the first time, but it is something that we're going to have to deal with, not only within the agencies and the departments, but also out in the market. And we're going to need to figure out new ways of not only putting things forward, but also new ways to finance them, capitalize them, roll them out, distribute them. And this is going to have a very much of a domino effect throughout all of healthcare. So I don't want to overstate this, but I think that the implications for this are very, very significant, especially as they move a lot of the advice and the therapies themselves out to the end user, the individual patient, who can then interact with the technology themselves directly. They'll be interacting with physicians differently. It calls into question immediately, for example, issues like state licensing of physicians and telehealth and telemedicine, because support groups and customer service are going to be walking a very thin line on delivery of healthcare services. It raises all sorts of questions around what kinds of licenses and capabilities and training are going to be required for those customer service organizations, and how those different entities deliver the service itself. So it's going to be a really, really interesting aspect of our industry that's going to unfold over coming months and years. And I would imagine that a great deal of both interest and capital, and quite honestly, patience, is going to be required for us to move to the next generation and next level of adoption for these technologies and access to these technologies. So it's really access and then adoption. So just to give you an idea, we've only had a very, very limited number of digital therapeutics already approved. There is one called, and I'm just reading from the web, I'm taking these from the website. I'm not reading from the website, but I'm taking them from the website because I think they're important and they're early signals here for the marketplace. The first is called Propeller Health, and that deals with asthma and COPD. The second is Virta Health, VIRTA Health, which deals with diabetes. Another is Akili Interactive, which deals with cognitive impairment therapies. And what's really interesting about Akili, and again, just to be clear, I have no economic relationship with any of these companies. They've not asked me to speak to these issues. They've not asked me to even speak about them. All I'm doing is just trying to contribute to the conversation around this hot topic. So again, I'm not paid in any way, shape, manner, or form, directly or indirectly, to advocate on their behalf. I'm just letting the public know what's going on in this space. Akili Interactive, though, I think is really interesting because not only do they help with cognitive impairment therapy, but they're delivering it through a video game. I thought that was very interesting. One Drop, which is a diabetes management protocol, or Lark Health, which has a nursing platform for chronic health issues, and then Therapeutics, which helps with substance abuse. Now, there's one other one which I'm going to read to you from the site, the FDA site, which is a company called Bioformis, BIOFOURMIS, and we'll put these notes down in the notes below the podcast so that you can access them directly if you'd like. I'm just going to refer you back to the FDA website. But what is stated in the Bioformis website is that every second, our FDA cleared AI-based ecosystem compares 20 plus physiological signals from a wearable biosensor with data from millions of other chronic patients. The result? Powerful pattern recognition designed to help clinicians predict and prevent deterioration before it happens. So think about that. This is a combination of things like, sophisticated database technology, sophisticated AI, sophisticated algorithms, sensors. One can imagine that the AI, which simply makes a recommendation or offers you a set of potential either outcomes or recommended behaviors, will develop into something a little bit more powerful that we would call a cognitive reasoning platform, where there taking action. They could be taking action altogether based on the analysis that the system, the application or the AI pattern is undertaking. So this is all very, very fascinating stuff. And you can see how these different disciplines are coming together in a way that really delivers incredible value back to the patient. And the question is going to be, of course, how does this all flesh out with regard to cost and approaches taken by not only clinicians, but also the patients themselves. So more to come on all of this. As you can imagine, this to me is a very rich vein of opportunity for discussion, and I look forward to really unpacking it. We will anticipate having other experts on who can speak to this issue. I'm really excited about the prospect of doing that because I think we'll take apart this complex set of issues and these exciting therapies and see kind of what the roadmaps are for some of these companies, where they intend to take this technology and this compilation of technologies into the future, what problems they see that they want to solve most rapidly and in what succession. And if there's a sequence that allows them to build on the foundation they're creating to solve more problems, more healthcare problems, more rapidly. So there's likely going to be that kind of a discussion unfolding as well. So while we see all this innovation and it's much more hyped on the financial services sector with things like cryptocurrency and non-fungible tokens for art, and then we also talked earlier today about antitrust questions with technology. Here's a good news story where we're actually looking at digital therapeutics in a way to solve healthcare problems, or at least address healthcare problems, and maybe even, at the worst case, manage them more effectively in a variety of different ways. Previously, really not well considered, not well resolved, and not well prepared. Whereas now we really are putting some very interesting technology together in a very, very structured way to solve meaningful challenges that so many of our population are dealing with. The areas around cognitive impairment, I think, are also very, very interesting. And so we can imagine people on the spectrum. Some might argue many of them work in technology because of their talents, and there's an opportunity to address those problems as well. Or I shouldn't say those problems, I would say those aptitudes and competencies and differences. So there's a huge market, I think, for digital therapeutics. It's unclear how the distribution models will work. Again, it's unclear how the capital formation will occur. It's unclear how even the governance will occur, and how regulations are going to manifest, or even what the approval process is. I think all this stuff is going to come to fruition here shortly. And I think it's going to take a lot of hard work and a lot of collaboration. One of the other things that I didn't point out is that the FDA also has established what they call collaborative communities, which are fora in which people interested in various topics can go to talk, and either live, in person, IRL, as they say, or alternatively in a forum that's online to address certain issues and advance the studies and advance the conversation. So we have a lot of different things going on here that are all very exciting and all very complicated. And so one of the things that I'm going to do, I'm going to take it upon myself, and hopefully you'll come join me for the journey, is to look into these issues and unpack them accordingly. So I encourage you to subscribe. I encourage you to get the notifications when the new podcasts come out, because there's going to be a rich, rich torrent of information that comes out over coming weeks and months on the issue of not only digital therapeutics, but also on a wide variety of other issues related to healthcare and other complex topics that the nation faces. So thank you so much for your time today. Again, I'm really grateful for your support, and I hope that you'll continue to support the podcast and also continue to join me in these conversations. Please feel free to comment on these podcasts. I welcome that, and I'll look forward to talking to you again soon. Thank you so much for your time today. Thanks for watching this week's episode of Civil Discourse. To learn more about today's topic or our guest, visit www.the60percentsolution.com or www.tfip.group.